Morning, here's your daily coronavirus update. Okay, I did a couple extra things today, so let me go through this really quickly. Luxembourg is just a mess right now with 301 people infected per 100,000, followed by Switzerland, Spain, Italy. I added a few new countries like Netherlands, Israel. So you can see that these are all cases, countries that have prevalence of above 50 per 100,000. The United States, we're at 47 per 100,000. That's a change by 6 per 100,000. From yesterday, our case fatality in the U.S. is about 2%. Worst case fatalities are highlighted in this, whatever that color is, 11 in Italy, so they're still the worst, followed by, looks like Spain, Netherlands, Iran, and UK and France are all pretty high. I did an average just so you can get an idea based on these countries. It's the top countries are all in here in terms of their prevalences. Average prevalence per 100,000 across the globe is 47 per 100,000. I should do this in millions across the globe, but it's okay for right now. And change from yesterday is 8 or 9 per 100,000, and the case fatality, so the probability of dying if you are infected, is 3% across the globe. Okay, now here's the usual figures, and then I'll go to this really cool new figure. This is the U.S. since March 12th, so we're still on the incline here. Look at Italy. If this is good, this may be good. I don't know. It looks like they might be flattening out a little bit since yesterday, so that might be good news. But they're still way ahead of us in terms of prevalence per 100,000. And South Korea, as we know, is doing really well. So this is the chart I've been showing the last couple of days, where we look at proportion over 65 and the number of hospital beds per 1,000 population. You can see that they mirror each other. I've been making this case that you do better nationally if you have more hospital beds. So it gives you an indication of public health in the country. And of course, this is density, population density. That's number of people per kilometer square. There's a lot of mirroring here in these data, except for, of course, this gray line is case fatality. But here's the cool one that I just did now. So what I did was I created this ratio. So I divided the hospital beds per 1,000 by the proportion of individuals, or the percentage, not proportion, percentage of individuals above 64. It would be the same, but it's just a little bit of a different scale. So this is that ratio right here, right? And this is your case fatality. So the more hospital beds a country has for people above 64 in relation to people above 64, the fewer the deaths there are. That is cool looking. So again, it tells you about public health expenditures and policy and what kind of issues we need to do. Again, so these are just raw data. I'm not controlling for anything here. We've already seen population density in the other figure, so we have to do some more studies or do some studies to look at, or data analyses to look at this, but this is pretty interesting. All right, this is Daniel Rodriguez. Hope you have a good and safe day. Keep on practicing healthcare, good health behaviors.